This video tutorial gives an introduction to the LEADER Realist review on the impact of economic recessions on drug use, developed as part of the EC-funded project LEADER, which stands for Looking at Economic Analyses of Drugs and Economic Recession. In this tutorial, Gera Nagelhout from Maastricht University will explain the aim of the LEADER Realist literature review, its specific characteristics and theoretical framework used, the findings of the literature review, as well as the purpose and outcomes of an additional review carried out on programs and services.
In the LEADER project, we performed a literature review in which we aimed to systematically identify empirical evidence of individual level mechanisms and contexts that explain how economic recessions affect substance use. Our first research question was, how have economic recessions produced short-term effects on the use of illegal drugs, tobacco, and alcohol in the adult population? Because there was so little evidence about the relationship between economic recessions and use of illegal drugs, we also examined how unemployment influenced illegal drug use. The literature review of the LEADER project used the realist reviewing method. Realist reviewing synthesizes research to examine how complex phenomena work and in what context they occur. The starting point of a realist review is an initial theoretical framework based on a scoping review. This framework is subsequently tested with empirical literature. We restricted our search to literature published since 1990. We searched peer-reviewed English language literature in 6 academic databases. We also examined non-peer-reviewed literature and found this through several websites and databases, such as those from the EMCDDA and the NBER. We searched for non-English literature in Polish, Hungarian, Spanish, and Dutch, which we found through Google and diverse national databases and websites. Our final sample consisted of 20 papers about illegal drug use, 27 papers on tobacco use, and 49 papers on alcohol. 35 of those papers on alcohol were part of a previous review by Monique de Goey. We made a distinction between studies that examined economic downturns or crises and technical economic recessions. With a technical economic recession, we mean 2 consecutive quarters of negative economic growth as measured by a country's inflation-adjusted GDP. We identified 7 key publications on economic recession and substance use, which were used to formulate our initial theoretical framework. In these key publications, we found several potential individual-level mechanisms through which economic recessions and unemployment could affect substance use. The first mechanism is the income reduction mechanism. During an economic recession, people's income can decrease. People may choose to decrease their substance use because they are on a tighter budget. Second, during an economic recession or when people get unemployed, their psychological distress may increase. People may try to cope with this increased stress by using more substances. Similarly, when people get unemployed, they may feel socially excluded. These feelings of social exclusion could lead to more substance use because people may try to cope with these feelings. And when people get unemployed, they may want to increase their job chances by reducing their substance use. And then finally, the non-working time mechanism. When people get unemployed, they have more non-working time. This increased non-working time can decrease substance use because people have more time for treatment, such as a smoking cessation course. More non-working time could also increase substance use because people have more time for using substances, for example, more time for doing drugs. Unfortunately, Most studies that we found only examined the impact of economic recession and unemployment on substance use without examining the mechanisms. Some studies examined the income reduction mechanism, the psychological distress mechanism, the social exclusion mechanism, or the non-working time mechanism. The job chances mechanism was not studied. What we found in the literature review was supportive evidence that individual budget constraints lead to less spending on substances by either lowering the consumption of substances or leading people to buy cheaper products. The evidence was stronger for alcohol and tobacco use than for illegal drug use. For illegal drug use, it was unclear whether budget constraints decreased use, and there was some evidence that it increased switching behavior to other drugs or other substances or other modes of drug use. For the psychological distress mechanism, we found sufficient evidence that recession and unemployment could lead to more psychological distress, and that this may be coped with by using more substances. There was stronger evidence that illegal drug use increased psychological distress than vice versa. For alcohol, the psychological distress mechanism was found mostly among men. We found supportive evidence for the social exclusion mechanism, but it was not studied often, and the studies were moderate in quality. The social exclusion mechanism was not studied for tobacco use. The evidence about the non-working time mechanism was suggestive of increasing illegal drug use, perhaps because people have more time for doing drugs. The evidence was suggestive of the non-working time mechanism decreasing tobacco use, perhaps because people have more time for smoking cessation treatment. However, this mechanism was also not studied often. This is how our refined theoretical framework looks like. The red arrows indicate an increase in substance use. The green arrows indicate a decrease in substance use. The gray arrow indicates no increase or decrease, but the use of cheaper products. Thicker lines indicate stronger evidence, and thinner lines less available evidence or evidence of moderate quality. The income reduction mechanism seems to decrease the use of tobacco and alcohol, and to not change the use of illegal drugs, because it increases switching to cheaper products. The psychological distress mechanism seems to increase the use of illegal drugs, tobacco, and alcohol. The non-working time mechanism seems to increase illegal drug use and decrease the use of tobacco. The social exclusion mechanism seems to increase the use of illegal drugs and alcohol, although we should note that the evidence for the last two mechanisms is not very strong. The overall conclusion of the literature review is that economic recessions and unemployment probably lead to an increase in illegal drug use because of an increase in stress and more time for drug use. Economic recessions can lead to an increase in tobacco use, a decrease or no change, because there are opposing individual level mechanisms at play. An economic recession probably leads to a decrease in alcohol use in the overall population because of budget constraints. It can probably lead to an increase only among men because they have more psychological distress and cope with this by using more alcohol. We should note that there is limited available evidence, and thus it is difficult to draw strong conclusions about context, settings, subgroups, and different types of illegal drugs in which results differ from each other. We also performed a smaller review on programs and services. The first research question was, to what extent do economic recessions impact negatively or positively on resourcing substance use prevention programs and substance use treatment services? There was little empirical evidence available. We found only 6 papers. In those 6 empirical papers, we saw a stagnation or decrease of resources for drug-related services and substance use services. We also saw a change in the type of treatment and the population served. For example, more use of cheaper outpatient treatment. The second research question was, is there evidence that policies and programs, for example, social welfare policies and back-to-work policies, mitigate any negative impact of economic recessions on substance use? Unfortunately, we did not find any empirical evidence about this research question.
The LEADER Realist review, as well as other LEADER outputs, are publicly available for download from the LEADER project website at www.leader-project.net. The next LEADER video tutorial gives an outline of the process and results of the LEADER Client Reality Check study on the impact of economic recessions on drug use.